Doc.
Hi.
Hi. My name is Caitlin. I'm going to be your nurse today. I'm going to be doing a neuro assessment on you. It's just going to involve me asking you some questions, okay?
Okay.
So first we're going to test your level of consciousness. And when I walked in, she was able to spontaneously open her eyes. So on the Glasgow Coma scale, you're going to get a 4. And next we're going to do orientation. So can you tell me your name and date of birth?
My name is Danielle Lear and my birthday is October 6, 1994.
Okay, good. And can you tell me who the president is?
Joe Biden
And can you tell me where we are?
at Central Carolina.
Awesome. Okay, so she was able to answer all my questions correctly, so she would get a 5 on the Glasgow Coma scale. And next, I'm just going to have you shake my hand. Thank you. Can you raise your arms up for me? Very good. And so she was able to verbally follow commands, so she's going to get a 6 on the Glasgow Coma scale. So she would have a score of 15, which is the highest you can get, and that is excellent. So the next thing we're going to do is we're just going to assess your mood and affect. So how are you feeling today?
Pretty tired.
Pretty tired?
Mm-hmm.
And that kind of matches up with what she's looking like. She looks a little tired. So I would say her mood and affect are congruent. And the next part of the test that we would do is a mini mental status exam, where we would just go through and ask the patient some questions. So now the next portion of the assessment that we're going to do is your cranial nerves. So the first cranial nerve we're going to assess is your olfactory nerve, which is number 1, and it's a sensory nerve. So what I'm going to do is I'm going to have some things for you to smell. So I'm going to have you close both of your eyes and obstruct one nostril for me. All right, and I'm just going to have you take a sniff. What do you smell?
Rubbing alcohol.
Rubbing alcohol. Okay, now we're going to do the other one. I'm going to put this up here and you tell me what you smell.
Lavender.
Very good. So she was able to smell both very well, so I would say that her olfactory nerve is intact. So the next nerve we're going to test is your optic nerve, and that's cranial nerve number 2, and it's a sensory nerve. So I'm going to have you take off your glasses for me. Very good. And I would have her take off her glasses because we would do the Snelling chart to test her central vision. So I would have her stand 20 feet away from the chart. I would have her look at the chart to see what lines she could read, and then I'd have her cover one eye and read it, and then cover the other eye and read it. Yeah, she'd have her glasses off. On? Oh, you'd have her glasses on. Never mind. Thank you. Have her read the chart, cover one eye, cover the other eye, and then we would determine what her vision was, whether it was 20/20, 20/30, and so on. And then I would also test your central vision with the Jaeger test, and I would just hand you a piece of paper to see if you could read it up close at 14 inches. Now we're going to test your peripheral vision. So I'm going to have you stand up with me. All right. I'm going to have you cover one eye. All right, and what I'm going to do is have you follow the bunny ears and tell me when you can see it, okay? So just look at me. All right.
See it.
See it?
See it.
Okay.
See it. See it.
Okay, now we're going to do the other eye.
See it. See it.
Yeah.
See it. See it.
Very good. So I would say your optic nerve is intact. You can have a seat.
Thanks.
All right, so the next nerve we're going to do is 3 of them together. We're going to do number 3, which is your ocular motor, number 4, which is your trochlear, and number 6, which is your abducens. And these are all just testing for eye movement. So now I'm going to have you take off your glasses. And I'm just going to be shining this pen light in your eye. I'm going to put my hand right here. So just look up at me. There we go. I'm just going to check your pupils. Very good. And they both constricted together, which is good. They're congruent. Now I'm going to have you follow the pen with your eyes, okay? Very good. So now what I'm going to do is I'm going to have you look at the wall at this clock right here. And when I tell you, I want you to look at the pen light and just follow it with your eyes, okay? Look at the pen light. Very good. So both of her eyes move together. They converge together, which is good. So I would say that your cranial nerves 3, 4, and 6 are intact. So the next nerve we're going to do is your trigeminal nerve, which is both a sensory and a motor nerve. So for the sensory portion of this nerve, I'm just going to be touching random places on you, and I want you to tell me if you can feel it, okay? All right, just close your eyes for me. There we go. Just tell me where I'm touching.
Forehead. Cheek. Chin.
Very good. Now I'm going to have your hand. So this is going to be soft, and this is going to be sharp. And I'm going to touch your face again, and I want you to tell me whether it's soft or sharp. Okay?
Soft, I think. Sharp. Soft. Sharp. Sharp.
There you go. Okay, so I would say that is intact, your sensory portion. For the motor portion, I'm going to be putting my hands up against your jaw, and I just want you to open your jaw. There you go. And can you move your jaw side to side? Very good. Very good. So I would say that cranial nerve 5, which is your trigeminal nerve, is intact. The next nerve we're going to do is your facial nerve. For the sensory portion of the facial nerve, we would be testing the anterior portion, 1/3 portion of the tongue to see if you could taste salt and sweet and salty, but we're not going to do that today. For the motor portion, I'm just going to look at your face and make sure it's symmetrical. Can you smile for me? Can you puff out your cheeks? Very good. And then I'm going to have you take off your glasses. And I'm just going to try to open your eyes. And once you close them, I'm going to try to open them, and I don't want you to let me. Very good. So I would say that her facial nerve is intact. Next nerve we're going to do is the 8th nerve, which is your vestibular cochlear nerve. And what I'm going to have you do for this one, if this is a sensory nerve. And what I'm going to have you do for this one is just cover one ear, and I'm going to whisper 3 words.
Should I repeat the words back?
Yes. Oh, yes. Sorry.
Red, white, blue.
Repeat them back to me.
Red, white, blue.
There you go. Now we're going to do the other side.
Apples, oranges, and bananas.
Very good. Very good. And so I would say that your 8th nerve is intact. Okay. Now we're going to move on to cranial nerves number 9 and number 10. Number 9 is your glossopharyngeal, and number 10 is your vagus nerve. These are both sensory and motor nerves. So for the sensory portion of cranial nerve number 9, that would be testing the posterior 2/3 of your tongue to see if you can taste bitter, but we're not going to do that. And for the motor portion of this nerve, I'm going to have you stick out your tongue and say "ah," and I'm just going to look at your pupil. Okay, so let's go. Say "ah." Very good. So it raised and it was midline, which is good. For the sensory portion of your vagus nerve, I would have you tell me if you have a feeling of fullness or if you have any uneasiness, and that's how we know that nerve is intact.
I'm very full.
You're very full? Then that's intact. And for the motor nerve portion of the vagus nerve, I would do a gag reflex on you, but I'm not going to do that to you today. I'm just going to see if you can swallow and have you forcibly cough for me. Very good. Very good. So I would say that both of those nerves are intact. The next nerve we are going to do is your cranial nerve number 11, which is your spinal accessory nerve. And what I'm just going to test for on this is if you can push against my hand with your head and your shoulders, okay? So I'm just going to put my hand here and just push. There you go. Push. There we go. Now shrug your shoulders up. Very good. So I would say that her spinal accessory nerve is intact. So for the last nerve, this is your hypoglossal nerve. It is a motor nerve. And for this, I would just have you stick out your tongue for me. A little bit more. There you go. I can see that it's straight. It's not drifting from side to side. Now I'm just going to have you push up against your cheek with your tongue. And I'm going to try to push it back. Very good. Very good. And I would say that that nerve is intact as well. So we're done with cranial nerves. Did very good. Very good. So the next portion of this exam that we're going to do is we're going to test your motor functions. Okay. So I'm going to have you stand up for me. Very good. I'm going to have you hold your arms out straight. And here I'm just looking to see if they are dropping or drifting at all, which they're not, which is very good. Now I'm going to have you hold your arms like this. All right, now I'm going to pull, and I want you to pull back. Very good. Now I'm going going to push, and I want you to push back. Very good. So that means that both her triceps and her biceps are very strong. I would give them 5 out of 5. Now I'm going to have you raise your knee and just hit it with my hand. Very good. And the other one. Very good. I would also give those 5 out of 5. Her legs are very strong. I'm going to have you sit down now. All right, now I'm just going to be testing your feet. So I would test her dorsi and her plantar reflection down here. So I'm going to have you lift your foot up just a little bit, and I'm going to have you push down on the gas, which is testing her plantar flexion. Now I'm going to have you pull up against it, which is testing her dorsiflexion. And both of those were very strong. All right, now we're going to move to the sensory portion of the exam. So we're going to do the same thing that we did with your face, but now I'm just going to do the rest of your body, okay? So I'm going to have you close your eyes and just tell me where I'm touching.
Arm.
Okay.
Leg.
Okay.
Leg. Ankle.
Good.
Arm.
Awesome. Now we're going to do the same thing where we did the sharp and the soft. So you just tell me what you feel, okay?
Soft.
Very good.
Sharp.
Very good.
Soft.
Very good.
Hard. Sharp.
Very good. Okay. And I would say that you passed all that. You could feel. If she was not able to feel those or is unable to do that test, I would do a temperature test where we use hot or cold water to determine if she could feel the difference. Now we're going to check your cerebellum. So I'm just going to have you stand up again. And for this, I'm going to have you just stand with your arms by your side. We're going to do what we call a Romberg test. So I'm going to have you just stand straight. I'm going to stand behind you, make sure you don't fall. And she's not swaying or leaning, which is very good. Now I'm going to have you close your eyes. And once again, she's not swaying or leaning or anything, so she's got a good cerebellum reflex. All right, and the last portion of this exam, I would test her reflexes, but we're not going to do that today. I would test her biceps, triceps, her brachial, radial, patellar, and her Achilles reflexes. I would also do a Babinski reflex. That's the only one we don't want to be positive. We want the Babinski to be negative. And that completes your neuro assessment today. Thank you for letting me do it.
Thanks.